Well, to our top story this morning, U.S. Preventive Services Task Force making major news when it comes to breast cancer prevention. Now the group recommending women to receive a mammogram starting at age 40. This is now 10 years earlier than the previous age recommendation. We spoke with Dr. Erica Hamilton, a medical oncologist here in Nashville, about the change. I understand there's some new studies that are coming out with new recommendations that can really help women if they are aware of what's being recommended to them, right?
Absolutely. I think it's been a little confusing over the past couple of years with some discordance on guidelines of when we should start our mammograms. So the United States Preventive Task Force has now recommended mammograms starting at age 40. This is every 2 years, but this is more in line with our other organizations, Center Disease Control, American College of Radiology, that have been recommending mammograms starting at age 40 and yearly. But this is a big change from the previous recommendation of 50, so creating some news.
Absolutely. And so when you think about it, so now is this a blanket saying, hey, 40 years old, you should be really prioritizing this? So there's no misconception about it now?
Absolutely. 40 at the latest. And I say by 40 really because there are specific risk factors that each individual may have: a family history, prior cancer, prior radiation, a known gene abnormality that puts you at higher risk of breast cancer, where screening could be recommended to start even earlier, but 40 at a minimum.
And I guess the best way to go about that, would it be just talking to your primary care doctor and letting them kind of help guide you, as long as you're doing some sort of moving in that direction to get the mammogram, right?
Absolutely. It's an individualized conversation with your physician about your risk factors, your family history, and what age is right for you.
You know, Dr. Hamilton, I find this so interesting because when you talk about cancer, I mean, it's a very scary word to say out loud. What surprises you most about this particular kind of research, and that would probably be helpful for people to know if they knew about it?
Yeah, I think, cancer is very scary. And so a lot of times we see people that just kind of don't want to think about cancer.
Right.
But the reality is cancer, particularly breast cancer, is very curable for most people now. And so us finding it early, doing what treatment is needed, and then going on to live a full and healthy life is really important.
Absolutely. And also important, before we wrap, I wanted to definitely touch on this, some of the health inequities that you're seeing in terms of this study and how it's affecting Black women more so now, and that's really increasing, right?
Absolutely. So this United States Preventive Services Task Force also had a call to action in some key areas of research, and one of those was health inequities among Black women. So Black women are over 40% more likely to die of breast cancer compared to white women, even though they're not more likely to get breast cancer. So very interesting, and really goes to point some of the health inequities in access, insurance coverage, screening to catch these cancers when they're early and more curable, and ultimately really in care delivery, delays in treatment, and even being offered as aggressive treatment regimens. So certainly a call to action for the healthcare community to really step up and provide better service for our Black patients in both screening and treatment to close this gap.
And of course, we'll post Dr. Hamilton's full interview online at WKRN.com with more on that new study.